Hi, everybody. Thank you for joining us today. It's Mike here from TwoDads UK. So I am really thrilled to be doing this particular live today because it's going to resonate, I think, with a lot of people, a lot of anxious people at the minute. So I am joined today by Sophie Martin, and Sophie is a midwife currently in a busy London hospital. She has been trying for a baby since 2017 herself, and in 2019 she gave birth very early to twin boys and sadly died shortly after birth. She runs the Infertile Midwife on Instagram, so if you're not following her, please do now. She's an inspiration to all of us, and she's here today to talk to us about a birthing plan through COVID-19. So I'm thrilled to have Sophie with us. So Sophie, how are you?
I am great. It's so lovely to see you. Thanks for having me.
No problem at all. And what a lovely day to be talking to you on. So I'm so thrilled that it's a nice day too.
Yeah, it's beautiful. Really lovely here.
Perfect. Okay, right. So I've given you a brief intro to yourself. Is there anything else that you wanted to cover off before we start with some questions?
No, I think you covered it all. But so as you said, I run the Infertile Midwife Instagram page, which is sharing my story of infertility and baby loss, and hopefully supporting other people going through the same as well.
Thank you. And again, just a super inspirational page. So thank you. So give her a follow, please. Okay, let's go in with these questions then. So we've got sort of 5-ish questions, and then there's going to be some tips from yourself in terms of any women that are watching that are imminently due to give birth and are super anxious. So let's talk about the rules of the one birthing partner and how that's being implemented. How rigid is that?
Yeah, so that's been implemented, obviously, because we're really trying to keep all the mums and babies safe, as I'm sure you can appreciate. So it's about reducing the flow of traffic into the hospital, encouraging the people to follow the government advice to stay home as much as possible. So it is fairly rigid because obviously the maternity services take it really seriously, the safety of the mums and babies. But there will always be exceptional circumstances which will require individual assessment. And the advice from the government is that changes to maternity services have to be reasonable and proportionate. So we can't, for example, say no birth partners. We have to be making reasonable adjustments.
Okay, amazing. I'm sure that last piece is going to give people a lot of comfort. And when should expectant parents be engaging with their trust to discuss their birthing plan during these crazy times?
Of course. So at any point in the pregnancy, you should be able to talk to your midwife or your doctor about birth planning. But usually there is a dedicated appointment at the end of the 3rd trimester to talk that through. If you've got any worries, raise them with your midwife now. It's very difficult to predict how long lockdown's going to last, obviously, but the midwives will know the plans and the procedures for their specific hospital. So if it's something that you're worried about, speak to them as soon as you can. But essentially, anytime you can talk to them about the birth plan, but at the end of the 3rd trimester is usually when there's a dedicated appointment.
Amazing. Thank you. So have you seen a rise or a spike in home birth since COVID-19? You know, are you seeing more requests for that because people are too anxious to go into hospital?
No, actually, surprisingly, we haven't seen a rise in the number of home births. I think a lot of people are anxious to come into hospital, absolutely, but we haven't seen a rise. If you have got suspected or confirmed coronavirus, it is actually advised to give birth in the obstetric unit in the hospital. So that would be an occasion where a home birth wouldn't be advised. But otherwise, if you're planning a home birth, hopefully it can go ahead. I do know a lot of trusts had to suspend their home births because the ambulance service couldn't provide the transfer to hospital. So do check with your trust if you have planned a home birth. That said, my trust has been able to carry on with its home birth system throughout. So it's really trust dependent.
Okay, thank you. Super useful. And then I guess the length of stay in hospital post-birth. Is COVID impacting the length of stay that women and intended parents are in hospital for?
It shouldn't be affecting the length of stay. So after someone's had a baby, there's certain checks that need to happen on both the mum and the baby to make sure that they're both healthy and well. And a lot of those can't be rushed and they need to happen at a certain time. So we wouldn't be rushing through those to send people home. Also, things like if it's your first baby and you want some help with breastfeeding, it's often nice to stay in the hospital for that extra support. So although, yes, we're trying to get people home quickly, as we always are, we're not rushing them out of the door. We're making sure that everyone's healthy and well before they go home.
Okay, perfect. And you touched on breastfeeding. I know we were talking about, you know, and again, so many mixed messages and you know, fake news, for want of a better description, in terms of what's safe, what isn't so safe. What's the current recommendation with breastfeeding a newborn at the moment? Is there any risk of transmission?
Yeah, of course. So there's no evidence that coronavirus is passed through the breast milk to the baby. And obviously we know that there are loads of health benefits from breastfeeding. So we do consider it safe to continue breastfeeding. Obviously there's a risk of transmission from close contact with anyone. So including close contact of bottle feeding or breastfeeding. So just follow the usual hand hygiene, so washing your hands before you're holding the baby, obviously sterilising bottles, things like that, and obviously no coughing or sneezing on the baby as well, obviously when you're holding them close to you. So just try and either pass the baby to someone else or try and sneeze or cough away from the baby. But in terms of breastfeeding, no, we still recommend breastfeeding. We know that it's got loads of health benefits. So if you are planning on breastfeeding, don't be put off by coronavirus.
Okay, great. That's great to hear. Now, I guess over to you for a bit more. What I'm always keen to do within these lives is to allow the guest speakers to give a bit more of an insight to either their role or their profession, and to share any best practices, tips or hints with regards to your profession. So this is over to you now. So in terms of what you would like to talk about, or your top hints or tips, so I'll hand over to you.
Oh, thank you. So we're going to talk a little bit about birth preferences or making a birth plan. So I would approach this as if coronavirus wasn't happening to start with. So think about all the things that you would want to happen regardless of this pandemic, because obviously they're the things that are most important to you, and they're hopefully the things that you'll want to carry forwards with you. I do tend to call it birth preferences rather than plan, and that is because preferences, I think, is encompasses that ethos of what you'd like to happen rather than being prescriptive of what's going to happen. Now, I think we all can agree birth is very unpredictable, so I think it's really useful to think about your preferences, so things you might want and things that you might not want to happen. So, for example, the place that you give birth, that's probably not going to change regardless of coronavirus. Who your birth partner is going to be, hopefully that won't be changing. Things like whether you want skin to skin vitamin K for the baby, they're not going to change because of coronavirus. So start off with those things first. Secondly, I do think that if it's your first baby, looking at a template can be really useful. So when you go to write your birth preferences, often you sit down and you think, I don't even know what I'm supposed to be writing here. So there's lots of really, really good templates available on the internet for free. So have a little look. The NHS Choices website has got a really fantastic one as well. And even if you don't use the template, it's really useful to see what sort of things are on a birth plan. But usually things like where you want to give birth, who's coming with you, what pain relief options you'd like, whether you'd be open to student midwives, how you're going to deliver the placenta, all that sort of thing. So have a little look at a template, and if you find one that you want to use, great. Often in your maternity book or your hospital might have a template as well for you to use. So I think that's a really, really good place to start if you've not written one before.
Amazing.
And then one thing I do think is quite important to mention in regards to coronavirus times is that if you already have a child, working out the childcare for those children whilst you're going to hospital, I think is really, really important, because obviously these are challenging situation and circumstances. Now, it might have been previously that you were planning on leaving your children with your parents, But for example, if they're elderly or have health problems and they're shielding at the moment, or they're isolating, obviously, who are you going to leave your children with? So it might be better to ask a neighbour or someone close by, but definitely make sure you've got a really, really firm plan in place. No one wants to be panicking when they're in labour thinking, I don't have anyone to look after my children.
Mm-hmm.
That definitely needs a little bit more planning because of coronavirus. So I would really recommend having, even a backup person that you might be able to get to look after your children. Obviously, things. Hopefully you'll just go into hospital, have your baby and come home, but they might be looking after your child for more than one day as well. So just really make sure you've got a firm plan in place. Were you about to say something, Michael?
No, go on. I'm loving this. I'm loving it.
Then I would also make sure that your birth partner has read your birth preferences. So the person who's going to be supporting you with the hospital, they need to really understand what you want from that experience. Obviously, you're going to want to have your baby healthily and safely, but all the individual bits, like who's going to cut the cord, whether you know the sex of the baby, who's going to announce that, make sure that they're on board with that, and make sure that they understand everything that's in the birth preferences. Obviously, antenatal classes are not happening, although a lot are happening online. So if you can, get them to sit on that with you and make sure that they ask any questions that they have, that they've got a route plan to the hospital. It can be really difficult for birth partners to feel that they've got a place. So I always think give them little jobs to do. So whether it's timing the contractions, whether it's making sure that the hospital bag's in the car, whether it's they're in charge of the snacks, that's a really good one. Don't underestimate snacks, they're very important. Give them a little job to do, make sure that they know what's on the birth preferences and that they're able to advocate for you if you're not able to. Labour is very intense, so they might need to communicate with the midwives or the doctors whilst you're having your contraction. So make sure that they know everything that's going in there. They understand all of that as well.
Amazing. Snacks are important.
And then probably my final point is please don't be frightened of all the equipment and PPE that everyone's wearing in the hospital. Is for your protection and for our protection as well. So it does look a bit scary when everyone's really fully gowned up and they've got the goggles and the mask on, and I know a lot of communication is via body language and facial expression, and that is a bit more challenging when everyone's wearing a mask. But just remember that everyone will still be smiling under their masks. I know that yesterday I was at work and you're chatting away and I almost forget that people can't see most of my face, and there I am smiling and laughing, and actually we are all still happy to be at work, making the best of this challenging situation. And yes, it does seem very medicalised that we're all there fully gowned up, but actually we're still trying to care for you in the same way that we know to keep you all as safe as possible.
That's amazing. And you forget the anxiety that the PPE kit must bring as well, in terms of how intimidating that might look.
It's very hot under there, I will say that. So the gowns and the masks just make you really, really hot. But we all understand why we have to wear them, and we just want to keep everyone as safe as possible, mums, babies, family. So it's a small sacrifice, obviously, to make for the greater good.
Yeah, absolutely. I could talk forever to you. I love all of this sort of stuff. Now, obviously, we're keeping these to 15-minute bursts, so they're really relatable and watchable and shareable. So, if people, so people that want to look you up on Instagram, just give us your handle on Instagram, please.
It's at the.infertile.midwife.
Perfect. Sophie, you've been amazing. Thanks for everything that you're doing in terms of all of the frontline work you're doing in maternity services. I've loved this. You're amazing. Thank you so much. Take care.
Thank you. Bye.
Bye now. Bye.